Right, good. Should we move on?
Yes, ma'am.
Yes, ma'am.
Yes.
Thank you, Dr. Abhishek. Thank you, ma'am, so much.
Thank you so much.
Thank you.
It was good. Thanks. Right, Dr.
Thank you, ma'am.
Muhammad Al-Tahir, are you ready?
Yes, I'm ready.
Good, thanks. Thank you for waiting. Right, if you're ready, I'm starting the timer. And
Okay.
here is the question. Right, so if you've read and understood, kindly tell me what are your differentials that you will consider for this patient.
Okay. I will consider
Yes.
osteoarthritis or septic arthritis.
Yes.
It might be osteomyelitis,
Yes. Yes.
or it can be gouty arthritis.
Very good. Okay. Can you tell me what is the pathogenesis of osteoarthritis?
Okay.
Your first. Yes.
After microbial infection, there will be acute inflammation. There will be
Very
the
good.
infiltration of the polymolecular and associated with fluid exudate and vascular
Yes.
congestion, lead to increase intraosseous pressure, and
Yes.
which lead to pain and obstruction of the blood flow.
Yes.
This will occur in the first day. The second day, there will be suppuration. The
Yes.
pus will be formed in the subperiosteal, which leads to subperiosteal abscess. After that, on the 7 days, there will be stripping of the periosteal associated with effective thrombosis and venous. This will block the blood supply, eventually lead to bone necrosis, which will lead to sequestration, the bone death.
Okay.
After 2 weeks, there will be formation of the new bone, which is called involucrum.
Yes.
There will, if the infection has been subsided, all it will lead to chronic osteomyelitis.
Very good. Can you tell me what are the organisms which are involved or most commonly seen
Okay, it
in
can be either
osteomyelitis? Yes.
gram-positive or gram-negative.
Yes.
Gram-positive can be Staph aureus or
Yes.
Streptococcus, or it can
Yes.
be Staph epidermidis. If it's gram-negative, it can be either Enterobacter such as Klebsiella or Salmonella or E. coli, also
Yes.
Pseudomonas and Haemophilus, and also might be fungal infection or mixed.
Can you tell me what are the methods through which these microorganisms they infect the bone?
Okay, it can be reached either through hematogenesis spread or either extensions from the contiguous site,
Yes.
or it can occur after implantation in the after fracture, bone fracture, or after surgical procedure.
Okay. What are the surgical procedures which can lead to osteomyelitis?
It might be intramedullary milling or lesson of the or knee replacement.
Can you tell me how metaphysics affects this through bloodstream?
It's either if it's in either so it can be affected through in the most likely in the infant and in the adult because there's vascular circulations. This vascular connections can lead to the spread of the infection through the metaphysics. In the children, there's avascular growth plate. This is prevent the
How
spread
does
of
it occur in adults? Because this patient is an adult.
Okay. In adults, this will lead to venous stasis and increases bacterial colonization,
Yes.
lead to bacterial formation.
These metaphyseal arteries that loop around the growth plate,
Okay.
and they enter irregular afferent venous sinusoids, and then the blood flow shows that they're turbulent and predisposing to bacterial seeding, and that's how it takes place. Anyway, can you define necrosis, please?
Necrosis.
How would you differentiate necrosis from apoptosis?
Okay. Apoptosis is the programmed cell death.
Yes.
There is no associated of inflammation and it's in energy dependent,
Yes.
while necrosis is energy independent and
Yes.
associated with inflammation.
Yes.
Necrosis is always pathological, while apoptosis can be either physiological or pathological. Microscopically, there is cariolysis or cariorectis
Yes.
in necrosis, while in apoptosis there will be cell shrinking and
Can you
apoptotic body.
Yes. Can you explain the mechanism through which pus or inflammation it bursts out through the bone?
Okay,
What is the mechanism? Yes, is involved behind it.
okay. After the subperiosteal abscess, there will be stripping of the periosteum.
Yes.
The lead to lifting of the periosteum. Then this can lead to sinus tract formation through the section of the soft tissue. Then will be sinus discharge.
And then there is increased
Increasing the
intraosseous pressure. Yes, which increases the osmolarity and there is tissue breakdown. Okay, in this patient, what should be the management of this patient's condition?
Okay, after full history and examination, we need to do some investigation, full blood count, and ESR, C-reactive protein.
Yes.
We need to do biopsy on blood culture. After that, we will give high IV antibiotic according to the culture and sensitivity.
Yes.
Also, we have to do X-ray or CT or MRI. For this, as it is me,
would you do the X-ray first or you'll give the antibiotic first?
I'll start the IV antibiotic first.
No, you'll do the X-ray first. Okay. Yes, please. If patient does not respond to conservative management that you are suggesting, what would you do next?
Okay, I will consider surgery. Patient might need surgical debridement of the infected bone.
Yes. How would you manage the pain of the patient?
I will give him some analgesia and splintage of the limb.
Yes. How would you decide?
Patient might need some rehydration.
Yes. How would you decide at what level of analgesia is recommended or is good enough for the patient?
According to the scale of the pain from 0 to 10.
Okay, but then there is WHO ladder. Can you tell me about it for the pain management? Pain management.
WHO.
Yeah, it's called WHO's ladder for pain management. You advise accordingly from mild to moderate to high advanced. Okay, right. We'll come back to that. You told me that there could be even because of internal fixation or because of some surgery. Why or how should that be managed if pain or osteomyelitis is being caused because of intramedullary nail that you've inserted?
Okay, this is will be a septic focus if it in this patient has cross leg.
Yes.
So we have to remove.
Yes, very good. That needs to be removed. Okay. If this chronic inflammation is not treated, what might be the complication that you can expect patient to develop?
patient with may have developed pathological fracture and he has or sepsis. Also, it might lead to squamous cell carcinoma or sarcoma. Also, it can lead to endocarditis. Or it can be secondary amyloidosis, or it can develop to chronic osteomyelitis.
Yes. There could sometimes be the formation of sinus, which is a tract formation because of chronic inflammation in the bone, and that a tract is formed which opens out into the skin. Yes, there is also one complication that can take place.
Okay.
How would that lead to pathological fractures?
It can lead to osteoporosis.
Okay.
Because it decreases the bone density and decrease in bone microarchitecture.
Good. Thank you. Well done. Yes. Thanks. Yes. Good. All right, Dr. Abhishek. Good night. You're leaving? Or Dr. Suman got a call? Okay.
No, ma'am. I said good night to Dr. Suman.
Yes. All right. Yes. Right. Yes. Please. Yes. Good. It was good, Dr. Mohammed. Anyone would want to add anything? Anything else we could have asked? Or
no, ma'am. You asked most of the questions. Almost everything.
Yes, please.
But the fact is, the first differential should be osteomyelitis for this case.
Yes, he did say that. Good.
No, he said osteoporosis.
He did. He said osteoporosis.
Sorry,
I think slip of tongue. I think slip of tongue.
I thought he said osteomyelitis.
But very important slip of tongue it is. You cannot
say osteomyelitis. That is wrong. I didn't even understand that he said that. Okay, I thought he said osteomyelitis. That's why I was asking him all the questions on that. Otherwise, I
said osteomyelitis.
I think he said osteomyelitis.
I said yes.
You first said osteomyelitis, Dr. Mohammed?
I think so, yes.
As a differentiate, yes, I mentioned. I said osteoarthritis and rheumatoid arthritis or septic arthritis. Then eventually,
like whenever ma'am asked you the differentials, also say osteomyelitis first. I am just saying it, but like ma'am asked the differentials for this diagnosis, right? So on the third point, you said osteomyelitis. That's what I can remember. So that's why I'm just
must
saying.
Be right. Yes.
First,
number one should be osteomyelitis.
Yeah.
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 Okay.
Always the most likeliest one should be the number one.
Yes.
Okay. And always remember 3, 4. 4 at least you should know. And the most likely one should be the number one.
Yeah.
Which you can defend later on. Good. Yes.
And
very good.
And
yes,
for osteomyelitis, we'll have to first do the X-ray, and then we'll send swab for culture sensitivity, and then we start antibiotic according to the culture sensitivity.
Yes. And if
no, do not wait for culture sensitivity report, Dr. Ulfat.
You can do the X-ray and you can just start with one.
After X-ray, you just start the broad spectrum antibiotic. Then, according to the culture sensitivity, like for culture sensitivity, you will always need around 2 days, 1 to 2 days. So don't wait for that.
So, but then if it's not